Hello, everybody. This is Dr. Francis Elwart with Total Health Systems with another episode of the God Health Experience with Total Health Systems. Today, my special guest is Samantha Schaller. She's a PA-C, also known as a Physician's Assistant Certified. Today, we're going to talk about to med or not to med. So a lot of times, as a chiropractor, a lot of us feel that people are over-medicated. Not obviously, there's medications that are necessary at certain times. And Sam's here to talk about when that might be necessary. And of course, these are our own opinions, which are obviously something that we feel strongly about. And we're going to just kind of get into it. So Sam, welcome to my podcast. I appreciate it.
Thank you for having me. I
Very
appreciate
good.
you having me on.
Thank you. And I also forgot to mention that Sam is a graduate of Trine University in Indiana at the Physician Assistant Certified program there. So again, you're obviously a person that deals with medicine and prescribing medications for obvious reasons. So tell us a little bit about what you're feeling on to med or not to med is.
Yeah, so I actually get this with a lot of my patients. They question whether or not they need to be on medications, when medications are necessary, and things like that. If I had a nickel for every time someone told me they didn't want to be on meds, I'd probably be rich.
Absolutely.
And so my job, and kind of the way that I look at it, is looking at the quality of life and looking at the risks and benefits of medication and seeing when they're necessary and when they're not. Because there are certain times when medication is absolutely indicated. You think, acute infection, or if you have something that's going on that needs to be treated. Absolutely. But there's a lot of conditions, and most of our chronic medical conditions are very lifestyle based, very based on things that don't necessarily need medication to respond to. Granted, like I said, there are times that it's necessary, and medication can be used as a bridge too, if you're looking to initiate some sort of lifestyle modification.
It's almost like over a certain hump, right?
Oh, yeah.
Okay.
Because
yeah.
there's a lot of risks sometimes with some of these chronic conditions. And like diet changes, exercises, they can take a lot of time. So we like to use medication to kind of get you to those changes so you're not just sitting in risk the whole time.
Right. Or sometimes a person's gravely overweight, certain things that they can't even move. So how can you exercise? How can you get to the grocery store and get healthy fruits and vegetables and lean meats and so on and so forth, correct? One of my feelings is, for example, I'll see a new doc, they retire or whatnot. I see a medical doctor as well, just for yearly checkups. And one of the things that frustrates me is some of these medical doctors, again, great people, but they have a different way of looking at things, is somebody has high cholesterol, they weigh 350 pounds, they eat fast food and a really cruddy diet, and the first thing they want to do is put them on a statin. Well, like you just said, how about we modify exercise or modify our lifestyle in terms of diet? That'd be more ideal, more healthy, and more cost-effective to the healthcare system, what do you think?
Oh, absolutely. And also, a lot of those things kind of overlap. High cholesterol often coincides with diabetes, with high blood pressure. And so if you can kind of figure out the core root of the problem, in your patient scenario, the overweight, the poor eating habits, all of those work together to kind of create this perfect storm of health problems. And so, I think it's really important when I have patients like that, depending on their levels. Like there are times where if their lab values are so critically out of range, they need medication to avoid heart attack or stroke.
Oh, sure.
But if they're within a range where it's relatively safe for them to try lifestyle modifications first, absolutely. Like I love to have a sit-down education with my patients, tell them, diet-wise, exercise-wise, what can help. And then typically in 3 months, I'll have them back. And then if there is significant improvement, even if their numbers aren't back in the normal range, if I see that they're trending down, I'm comfortable kind of continuing that and then just watching them and then introducing medication if it becomes warranted. But I think the risk is with those types of patients, if you start them on meds right away, you're not really treating the problem, you're kind of just band-aiding it.
Right.
And so if you continue to eat fast food every day, no amount of statin is going to help you.
Oh, I agree 100%. And I think one of the things too, honestly, is it's really the relationship with the patient. I think a lot of doctors, physicians, assistants, chiropractors, whoever, are almost intimidated to tell their patients the God's honest truth about what's going on with them.
Yes.
There's obviously a social something we have to be kind about with the patient, but honestly, like tough love. I mean, and that's really what it comes down to. I had a lot of patients come in, guys my age, I'm 50, beer gut, no rear end, they don't have any leg muscle mass, whatnot. And it's something you just got to be honest with them, like, hey, Steve, Bob, Tim, whoever it might be. We got to work on this stuff. And, I'm just telling you, not only as a doctor, but in a sense, almost as a friend who cares about you, that you need to take care of these things. Because if you don't, you're going to be running. And I'm 50, so I tell patients, especially, it seems like my practice is a lot of guys my age for some reason. And I'll say, there's a fork in the road in a sense. You can go down the road you're going, end up in a wheelchair, a walker, that typical, nursing home kind of look. Or I've seen some guys in their 70s and 80s just ripped. Now that's more extreme, but somebody's in good shape, can play golf every day, can shuffleboard, can go out with their wife or significant other and go on trips. I mean, it's really about quality of life.
Oh,
right?
absolutely.
Yeah.
And I find that, going back to your tough love comment, like I absolutely agree with that. And I find that in having those conversations with patients, a lot of them don't realize areas in their life where they can change. I have a lot of patients that come in, high cholesterol, diabetes, and then their first thing they say to me is, well, I do everything right. Like, I don't know how I'm doing this. And thankfully, here at Total Health Systems, I get a half hour with my PCP patients.
That's huge.
It's amazing. And I get to talk to them, and I will break down, like, what do you eat in a day? Most of the time, that's where I find out people are saying that they have pizza 2 or 3 times a week. Or when I ask about exercise, and they're like, oh, I walk a lot at work. And it's like, okay, that's not necessarily what I'm looking for. And so I get the opportunity to kind of see when they say that they think they're doing everything right, there's a lot of room for growth most of the time. And so getting the chance to discuss that with them and shed light on what the actual problem is, and then giving them the time to work on that. And then if things don't go well, if they're really resistant to making these changes, then of course medication is an option and something that I'm more willing to lean
you have
towards.
to save them and save their life. Obviously, that's your job as a medical practitioner.
But I find most patients are, if you're honest with them and if you tell them kind of what's going on, they're very willing to give a shot at lifestyle changes. And I always warn them, like, if we try this for several months and nothing's changing, then we need to look at medication more seriously. But very rarely is it my first choice. Now, if someone's cholesterol was ridiculously high, then different story. But those are pretty far and few between. Sure,
you get the extreme cases, of course. And that's one thing that, as a chiropractor, we always talk about patients with, as far as what kind of care you need. Unfortunately, there's cost to like anything in healthcare the way that we are in this country. But most people honestly take better care of their car, their boat, their landscape than they do their own bodies.
Oh, absolutely.
And I just, not being judgmental, but it's just, how can you let that happen? I mean, you only get one body. You can get a new lawn, you can get a new car, you can get a new boat, right? I mean, that's something that's really important, is taking care of yourself and not only for your family, but for yourself.
Oh, absolutely. And I think also just getting the involvement of experts is really helpful. Especially, you mentioning a car made me think of that, because you get a lot of people that say, it's my body, I understand it. And people do. Like, what you're feeling and you know how things affect you. But sometimes that leads people to be really resistant to medication because they know themselves. But what I always say to that is, I drive my car every day. But if something goes wrong, I'm taking it to a mechanic. I'm not the one that's going to be dealing with it, even though I drive it every day. And that's kind of where I see, like, medicine be more of a point in people's lives. It's not something that is going to save you from yourselves. Like, lifestyle changes, that's most important. But if something happens, if you have critically high cholesterol, if you just had a surgery, if you have an infection, like, there is a point to have medication, and it doesn't need to be long term. And if you aren't taking medication all the time, those short bursts of meds can be very, very safe. Like, people always shy away from antibiotics, and I don't like giving them very often, but there is a time when they're needed, and they can be life-saving.
100%.
It only becomes an issue if you're getting them all the time.
Right, so. And that's the thing. I mean, everybody knows me. When I think about healthcare and lifestyle, I always look at I just say the word caveman, right? How did they eat? They fasted, they high fat, high protein diet, berries, minimal carbohydrates. They quote unquote worked out a lot through, climbing mountains, climbing trees, running after their own food, right? But at the same time, you get to realize if one of them fell out of a tree, fell down a mountain and broke a leg and had an infection, they're kind of a goner at that point.
Oh,
So
yeah.
you want to go the natural innate route, but at the
Yeah.
same time, it's necessary sometimes to go a medical route.
Oh, yeah,
right?
absolutely. And that's especially being exposed to a lot of chiropractic and physical therapy patients. I feel that as well. Like most of the time, probably 95% of the time, that's all patients need is some, strengthening, some adjustments. However, if you break a bone, I'm not going to recommend like a chiropractic adjustment for the broken bone.
Correct.
Like I would recommend, casting, proper treatment, possibly pain medication, and then once you're strong enough, you can reintroduce that more lifestyle modification. But I think people tend to look too much at it as one way or the other. Like I don't like taking meds, or I want meds for everything.
Right.
And there's a balance that I think we as a health society are moving towards. I don't think we're there yet,
Right.
but.
And the thing too is, I mean, I don't want to give the name up. Obviously, I know you know who I'm talking about. There's a certain trigger point injection patient we had in the last month or two. A guy in about his 30s his spine has some problems. I did the best I could with what I had in my toolbox as a chiropractor. He saw physical therapy, did well enough, but he still had some problems. So I sent him to Sam for what's called a trigger point injection. A trigger point is just basically a bundle up piece of muscle that just won't let go.
Yes.
And he did really, really well.
Yeah, he did.
I think one of our physical therapists said he was like 70% improved as far as muscle spasm or tonicity.
Oh, yeah.
His pain levels came down pretty decent. Now he's got other issues we're still addressing with other practitioners. But that's what I like about our practice too is we have yourself, we have a physical therapist, acupuncturist, massage therapist, a whole host of practitioners that we all work together and talk amongst each other to do what's best for the patient. That's huge.
Yeah, and it's amazing because we can bounce off of each other really quickly. Like I wouldn't ever pretend to know nearly as much about like spinal alignments or anything like that than you chiropractors would. Like I would expect if someone had really high cholesterol, I would expect that to come more to me. So we bounce off of each other really well, and I feel like all of us here know our areas of specialty.
Right.
Like the amount of times I've come to either a chiropractor or PT with a patient that is either presenting really weird or I have no idea like where to go from it. It's very helpful.
It's huge. And that's one thing I like about our practice. And that's kind of the key. I will say, everybody asks me how I feel about certain like medicine. I mean, there's always like this medicine versus chiropractor feeling, at least amongst patients and maybe some of the community. It's not really like that. Everybody's got their own piece of the pie. Stay in your lane, do your job, and everybody should get along just well enough, I would think, right? You and I talk every day,
all the time.
It's not a problem. I mean, just do what you're supposed to do within your scope of practice.
Oh, yeah.
And everything should be just fine. And it's better for the patient that way. They're not getting confused with who just ask what to. Obviously we can ask questions as patients to our providers, but for the provider sometimes just doesn't know.
Oh, yeah.
And that's okay because I know a lot, but I don't know everything. Same with you. And that's why we all bounce off each other, right?
Yeah, and it's really helpful. And like you said, even for the patient, just getting them the most accurate treatment and the most accurate even just answer to the question. Like I've had so many patients that I'll have in my room that they will ask me something that I just don't know, and I always ask them if it's okay, and I'll pull a PT into the room if they're not seeing the patient. Like they'll answer questions for them, and so it's really helpful. And then vice versa, I've had PTs who they'll have a diabetic patient whose sugar goes really low all of a sudden, and I jump in then. So we trust each other enough to kind of involve everyone in a patient's plan of care, which I think is not always the case, sometimes in more of these isolated medical only clinics.
And that's one thing too you mentioned earlier about the time we take with patients. I mean, a lot of chiropractors, unfortunately, they're very busy and they don't take very much time with their patients. So I've had patients go, I saw my medical doctor, my chiropractor, or my physical therapist, whoever it might be. I didn't know what was wrong with me after I told them what was wrong with me. I didn't get a diagnosis. The treatment was just come back in 2 more days or 2 weeks or 3 days a week. Yourself and myself, we get enough time to explain to our patients what their problem is after they tell us their symptoms. We get to explain fully what's going on with them and how we're going to fix them, or the best we can, hopefully. And then the treatments make sense to them.
Oh, yeah. And
right?
I've had so many patients that just because I get the time with them, like we'll be reconciling their meds and seeing which ones they're taking, and most of them don't even know what they're for. And so because I have that extra time, yes, like I have more time to interview the patient, diagnose, treat, all that, but just more time to talk to them Because patients,
They're people.
They're people, and not
Right.
not everyone's medically minded, so people don't always know what's important medically.
Yeah.
So I have that time to, in a sense, like talk through it with them and pull out like what's going on and what's
Right.
actually important. I've had PT patients that in the last 5 or 10 minutes of the appointment will be like, "Oh yeah, also I had a car accident last week." I'll be like, "Okay, hold up, like that was
It's a whole
important."
different story, yeah.
Exactly, and like they don't necessarily know that changes my train of thought, and it's not their fault. They're not
Right.
medically minded, but because I have, new patients and PCP follow-ups are half-hour long, like I have time to explore that with them.
And that's the key, having the time with the patient. If we don't have the time with the patient, you can't make a good clinical decision. Your differential diagnoses are off.
Oh yeah.
Treatment might be off. So, and that's one thing I think, we both agree. That's why we like working here.
Oh,
I've been here
absolutely.
with this company 8.5, 9 years. You just recently came on with us, and I think you see the difference compared to other places.
Oh, 100%.
Right.
Like a lot of other primary care clinics, they just try to pump out the patients as quick as they can,
Unfortunately.
which is unfortunate. And there's a lot of people that need to be seen, so it's a combination of
Yeah.
need and, profit,
Yeah.
obviously. But here we are given enough time with
Right.
the patients, and which I do really appreciate because, you're trying to boil someone's medical history into 15 minutes doesn't
Right.
always
No.
work out.
Not at all. And my disclaimer always is I don't knock anybody on how they do anything, obviously. It's
Uh-huh.
just everybody has a different mindset of what they're trying to do. For me, it's quality over quantity,
Oh,
least
yeah.
at least with what I do in my part of the practice in this company.
Mm-hmm.
But it's huge. But anything you want to maybe close with as far as, kind of totaling or
Yeah.
concluding with what you said overall?
Yeah, well, overall, I just want to assure patients to not be afraid of medication. There's a lot of real good that medication can do, but in terms of these long-standing chronic complications, lifestyle, diet, and exercise is so much more important than people think.
It's huge.
Medication has a purpose, and it's very important and life-saving. But however, if you really do want to make honest lifestyle changes, it'll change your life.
Yeah, I agree 100%. Well, thank you, Sam, for being my guest today.
Thank you for having me.
Appreciate it. And as always, here with Total Health Systems, we're here to help you with your optimum health. You deserve it. We'll see you the next time. Thank you.